Folks, we're going to be starting a few minutes late, so just hang in there.
Good to see you again. It'd be better if you could stand on this side. It just because of the angle of the camera. And then I can bring you the position. Is that your coat?
Yeah, it is my coat.
Bring that over here for you. So you have a place to sit down. And we should be starting shortly. Does anybody need another sound check? Is everybody okay?
Yes.
She does. Audio check, testing 1, 2, 3. Audio check 1, 2, 3. Testing audio 1, 2, 3. Did you get it, ma'am? Okay. Audio check, testing 1, 2, 3. Audio check. Great.
You'll learn by the end of the day.
Dr. Box is going to see us deliver the message to me. Elbow bumps. Well, thank you for all turning and burning to get here on a moment's notice for this important, not just announcement, but the sharing of some important details as we all go forward. We're here today to announce that Indiana has, in fact, received its first case of coronavirus COVID-19. Our state health commissioner, Dr. Box, and the other medical professionals that you see here will be discussing the specifics of the case and our response, those specifics that we can, in fact, share. But I did want to also stress and underscore how we are moving forward. I have just signed and declared a public health emergency to ensure that the state of Indiana is in the absolute best position to get the federal funding necessary to respond step by step. Again, as we have all said since January, since the outset of this, and today just serves as yet another reminder of the importance to stay informed and prepared as you carry on with your daily lives. So with that, I'd like to ask the Commissioner of Indiana's Department of Health, Dr. Chris Box, to share some of those details that we are able to and some of the steps that you'll see unfolding as the days ahead move on. Thank you.
Thank you, Governor. Good morning, and thank you for coming on such short notice today. We're here today to announce the first presumptive positive case of COVID-19 in the state of Indiana. The patient is an adult who recently traveled to Boston and had contact with individuals at an event last week where positive cases have been identified. This individual is currently in isolation, and there is no ongoing risk to the public. With the global spread of COVID-19, the question has never been if Indiana would get a case, but when we would see one. We have been preparing for this possibility, and I want to stress that this is an isolated case at this time. I also want to commend this patient, Community Hospital North, and the Marion County Public Health Department for their swift actions in this matter. The patient and the hospital did everything possible to limit the risk of exposure to other individuals. Because of those steps, the risk of additional exposure and community transmission was decreased, and we're taking every precaution to prevent new infections related to this patient. I encourage Hoosiers to continue to educate themselves about COVID-19 and take steps to protect themselves from this and other respiratory illnesses by covering their coughs, washing their hands thoroughly, not shaking hands, but doing the elbow bump, avoiding touching their faces, and staying home if you're sick. The situation with COVID-19 is changing rapidly, and we can expect to see other cases in Indiana in the future. As this case demonstrates, we are prepared for that possibility, and we will deploy all steps needed quickly to protect Hoosiers. We have spoken with the governor, as you can see this morning, and he has declared the public health emergency. This will help to not only alert Hoosiers to be on heightened awareness for this, but as the governor says, will allow us to make sure we have access to the resources that we need. Also, Dr. Kane from the Marion County Health Department would like to make a few comments, and then Dr. Yaletti and Dr. Ledyard from Community Hospital North will walk us through how this was managed at the hospital.
Thank you, Christina. Governor. For the past month, the Marion County Public Health Department and the Indiana State Department of Health, we've been preparing for this potential spread of the COVID-19 to our community. And I can honestly say, I think, Christina, I don't know that I talk to you every day, but I definitely talk to you every other day and evenings. So we've been working very closely during this time to help prepare and respond as necessary. We've been meeting with all of our hospital healthcare systems, communicating with them at least once a week since late January. So today's announcement that confirms this first case might cause some additional concern among residents and people who work here, but we have to emphasize again that we are well prepared. We've been waiting for this situation, and because this is just one case, we're going to continue to just have the public do the things they need to do in order to protect themselves. Now, the Marion County Public Health Department and the Indiana State Department of Health will continue to work together in the contact investigation and the monitoring of this patient. And we're going to make appropriate recommendations to anyone we feel might be at high risk for contracting this COVID-19. And although this doesn't change the guidance for steps that each of us can take to reduce the possibility of spreading respiratory viruses such as COVID or even the flu, and I just want to reiterate what Christina is saying, that stay home if you're sick except to get medical care. But I want to say, when you seek that care first from your provider or your physician's office or in even an emergency room, please call ahead first. We do not want an individual contaminating anybody in a waiting room area. So let us take the necessary steps we need to do to protect anybody while you are seeking medical care. So please let us know. And I'm going to also say, guys, we don't even want you shaking hands. We don't want you hugging anybody. And we do want you to know how to learn the Indy bump when you're greeting other people. And so just know that you have to wash your hands frequently and are using alcohol-based hand sanitizer. And it has to have at least 60% or higher alcohol content in order to be effective, and clean frequently and disinfect all surfaces that you come into contact. We have an opportunity to keep our community healthy and safe, and we have incredible, when I tell you we have incredible healthcare professionals here, hospital systems who know how to do the right thing. We're very fortunate to be in the state of Indiana and in this community. And just want to thank again all the expertise that the Indiana State Department of Health has brought to the state of Indiana, and her collaboration with all health care officials, all local health department officials in the state of Indiana. Reminder, we're well prepared. Thank you.
Thanks, Governor Chris and Jenny. Good morning. My name is Ram Yeleti. I'm the Chief Physician Executive for Community Health Network. Just want to briefly explain the events that occurred last night and why we feel comfortable at this time. So there was an individual that had called the State Department of Health last night stating they're concerned that they may be positive. The State Department of Health asked that individual to go to Community North Emergency Room for testing. Prior to him arriving, the Community North Hospital Emergency Room Department was notified he will be coming. Once he came, he stayed only in the parking lot. At that time, our caregivers, dressed in the appropriate infectious disease precaution material, received him. He was then placed in the appropriate material as well as a mask and other appropriate infectious disease precautions. He was taken back to an isolation room through a different side entrance, not in contact with any other individuals. He was placed in a room that has negative airflow, and then the appropriate testing was done. After that was completed, he was then transferred back to the self-quarantine where he previously was located. I want to reassure you that no patients, no other caregivers were exposed to this individual. We're exceedingly cautious on the route he took and minimal to zero exposure to anybody that did not have protective infectious disease material. Because of that, I want to state, especially for the patients that are at any hospitals today, that they should still feel comfortable that their loved ones are safe. There's no risk of them getting infected right now, and we would reassure that all patients at this time, we do not see any evidence for any spread of this. Thanks very much actually to the prompt response of the State Department of Health notifying us, and so that we could take the appropriate precautions. I do want to also underscore what Jenny was saying is that all of us, all healthcare professionals, have been planning for some time. Again, as she noted, it was a matter of when, not if. With that, we feel very comfortable. We have everything prepared to do the best we can to handle these situations. The most important thing I would re-stress what Jenny was saying is not to panic. It's also very important to understand that wearing a face mask is not going to reduce your risk of infection. Face masks are for people who we consider maybe potentially infected. General people, population like ourselves, will not benefit from face masks. The most important thing you can do is very frequent hand washing and minimize touching your face. But face masks there's a limited supply, so I don't want people trying to rush out finding those. Those are meant for the patients who possibly be infected. Again, I want to reassure you that the hospital is doing everything they should, and the risk to patients right now is minimal. I'd like to introduce my colleague, Dr. Robin Ledger, the Chief Medical Officer for Community Health Network as well.
Thanks, Ram. Thanks, Jenny. Thanks, Chris, and thanks, Governor. I just want to stress and close with saying that, as Dr. Yeleti said, we feel that Community Hospital North is in good hands. We have not infected any caregivers. What I'm going to close with is reminding the public that these are the symptoms that we want you to look for, to think about if you feel you've been exposed to COVID-19. If you feel you've been exposed to COVID-19 and you have a fever, a cough, and or shortness of breath, then as Dr. Kane said, please call. Please call to either your primary care provider, your local network, Marion County Health Department, State Department of Health. You will be appropriately triaged for whether or not you need to come in to be tested. It's so important right now that we as a public band together to make sure that we support each other, treat each other, but also understand the nuances with COVID-19. The team at Community North was textbook in their treatment of this person, but it was because they were called ahead, warned that this person was coming, and they could meet them, and again, as Dr. Yaletti said, transport them through an area without undue public exposure. So we have to get the message out from a public health perspective of how we treat this disease, not where you just rush into a site of care, but call. If you are concerned that you've been exposed and you have the associated symptoms, please call first. And again, we can't say it enough, keep washing your hands, don't hug right now, and let's take care of each other. So thank you very much.
We'll be happy to take some questions, myself or Dr. Kane. Yes.
Can you talk a little bit more about the symptoms this person had and how you tested this person for COVID?
Certainly, this individual had developed some very mild symptoms, actually. I think a sore throat, low-grade temperature, 100 point something, and the individual also was developing a little bit of a cough, and realized, because he had received information from the individual's work, that there may have been an exposure, was watching for those symptoms. And the tests are basically 3 types of tests we do: a nasopharyngeal swab, where we put it into the nasal area, into the oropharyngeal area, and then if we can get sputum where someone coughs deeply and coughs something up, then that is a really good specimen also.
Dr. Box, where is the patient from and how old is he?
The individual is a Marion County resident, and it's an adult.
Age range?
Not in our highest risk category.
Gender?
We usually don't give that information out.